Dr. Aliya Umar is a passionate advocate and accomplished author shedding light on the systematic racism plaguing the NHS in her groundbreaking book, BAME in the NHS, Overcoming Racism and Reclaiming Healthcare. And Dr. Aliya is with us here. How are you today?
I'm very well, Toby. How are you?
Excellent, thank you. Now, what was it that inspired you to write this book, and what message do you hope to convey through it?
So, really, when I started writing my book, Is It Because I Am BAME? It started off just because I finished my training as an obstetrician and I became a consultant. And it was really just a moment for me to sit down and reflect over the kind of past 15 years that I've spent in the NHS. And it
Hmm.
started off just as a personal account, me writing down my experiences, my challenges, my success, and also that of the people around me. And then it actually then turned into a bit of I then ended up discovering a lot of things that I hadn't known, so for example, I figured out that the issue of racism is more than just a personal experience, an experience of people around me. It's something that is now beginning to affect the NHS. It's beginning to, in what I discovered was, as we will go on to discuss in more detail, was that this issue of racism is not only affecting the people that are suffering it, it's actually then impacting on patient care, it's impacting on the economic challenges of the NHS, and a
Yeah.
lot of messages that I would like my book to convey is first of all to the people that are experiencing this racism, and what they can do about it, and then also the people that are perpetuating the racism, and sometimes it's actually subconscious. People don't realize that they are behaving in a certain way towards others. So it's really a message to various people that are going to be reading my book.
Yeah. Now, what are some of the personal experiences or stories that have influenced your understanding that of the challenges that BAME individuals face?
So, for example, some of my personal experiences is working as a Black Muslim woman in the NHS. I
Mm.
used to get mixed reactions. So you find people who are absolutely, for example, I had one of my consultants when I was training who said to me, by the way, he called me at the end of a shift and he's like, I've observed you and you're really different. And I'm like, well, what do you mean? He's like, first of all, your English is really good. And I was like, thank you. And he just went on to give me a whole bunch of compliments that I thought that was
Mm.
really sweet actually. And then you get another extreme end of people who are like, by the way, is this your first time in the operating theatre? Not because they haven't, I've done something wrong. It was, for example, you just walk into a theatre, people look at you and they say, because you're wearing, for example, a headscarf, and they're like,
Yeah.
oh, is this your first time in theatre? Almost as if trying to say people in theatre do not wear a headscarf. So, I've had kind of mixed reactions to my being in the workplace in the NHS. And that's one of the challenges that I've faced is that people look at me and they're not quite sure what to think. People might be outrightly hostile and outrightly, discriminatory. And sometimes it's really very subtle. And then, as I said, obviously there's the opposite end, people who are like, actually, you're quite interesting. We've never met someone like you. And that's one of the reasons I also wanted to start this conversation, because I find that there are people out there who want to know more about the experiences of the BAME community, and they're not quite sure how to start the conversation or even what appropriate, like, what kind of words are acceptable. For example, I'm going to give you another incident we had
Mm.
while I was on the labor ward, and there was I think there was a patient who was, I think she was Asian. Yeah, she was Asian Pakistani. But then the staff were they didn't quite know how to address her. So they said, should we call her the colored patient or should we call her the Asian patient? And it was actually a discussion that people were
Mm.
having. And I was like, you know what? I'm actually glad people are having these kind of discussions, because there are people on the extreme end who do not want to begin to, when this kind of conversation begins, they walk out of the room, they feel really awkward. So yeah, that's one of the some of the personal experiences that I've had around the topic of BAME.
Yeah. And in your research and the writing process, what were some of the most surprising or eye-opening discoveries that you made with the experiences of BAME people?
So yeah, some of the kind of quite surprising discoveries that I made is, for example, working in the NHS, because I mean, talking about BAME is a very big topic. So I'm kind of focusing on the experiences of BAME individuals in the NHS. So, for
Yeah.
example, if you are a BAME, so an ethnic minority doctor or nurse working in the NHS, you are actually more likely, believe it or not, to be referred to the GMC or the, Nursing and Midwifery Council for making a mistake. You're more likely to be referred. But then
Mm.
it turns out, surprisingly, that when the investigations have been done and concluded, majority of these referrals are dismissed, meaning that in the beginning there was no reason to be referred to the NMC and the GMC. But then it turns out that your white colleagues are more likely to have done a very serious, committed a very serious error. For example, as the likes we've seen recently of Lucy Letby, the nurse
Yeah.
who made very very shocking very shocking discoveries we found about her working in neonatal unit, and a few years ago about people like Harold Shipman.
Mm.
So people who and these are people who would you look at them and think, oh, this is just the perfect nurse, and with all due respect, she's blonde, blue-eyed, whatever. And people would, it took a long time for her errors to be noticed. And with all due respect, there is some element of racism in that. And this is one of the problems, that you can actually overlook real fatal errors that are made just because of that bias towards someone. Just as you can discriminate against a Black and ethnic minority person, you can actually have a positive, what I call a positive prejudice, which
Mm.
can then lead to problems and fatalities, as we've seen. So that's one of the most shocking discoveries that I made. Yeah.
Yeah. And how do you think the book can contribute to raising awareness and promoting understanding of the systematic issues faced by BAME individuals, not just in the NHS, I suppose, but just generally?
So I think generally, because the book talks about the general experiences of people, and it's a
Mm.
book that can be read by a layperson. It can be read by people in universities. Anybody can pick up the book and read it. It's not just specific for people working in the NHS.
Yeah.
And I think it can really contribute to raising awareness, because when you read this book, you can put yourself in the shoes of the person who is experiencing the racism. And I think, like I alluded to at the beginning, of the conversation that we're having now, Toby, is that
Yeah.
it first starts with being comfortable, talking about the issue, because it's an issue that a lot of people are not even comfortable talking about. So, when you read the book and you're able to put yourself in someone's shoes that is experiencing racism, you begin to think, oh, hang on a minute, how would I feel if that was me? Or
Mm.
hang on a minute, how would I feel if that was my friend or my family member? Because at the end of the day, we are all human. We have a lot more alike than we have in our differences. And it's not difficult to feel someone else's pain when you read the narratives that are in my book. So I think really it starts with people picking up the book, reading it, and talk about some of the things that you read. You might find some of the stories that I share might be funny, some might be outwardly shocking, and
Yeah.
so it starts by just reading and just feel what people are going through.
Yeah. And are there any specific policy changes or societal shifts that you believe are necessary to address the challenges that BAME individuals face?
So I think policy is a very tricky question, because there's
Mm.
always new policy coming out. There's a lot of paperwork. So for example, the NHS has started something called the Ready Now program and the King's Fund, which is a fund that's been allocated to improving the experience of Black and ethnic minority workers and patients in the NHS. So it's really good to see that the government generally is more kind of working better to alleviate the discrimination that's faced by BAME communities. But I think it's about empowering people as well. So, and this is also a message to the BAME community. You also need to step out. One of the things that I did in my training is I realized that it's not enough to complain or just go out and say, oh, people are behaving discriminatory, people are discriminating against me, and it's not enough to complain. You need to go out and you need to join the movement. You need to see what's available in your local hospital, in your local community, community. There's BAME groups springing up everywhere. But I think one of the things is that there is lack of awareness. People do not realize that they can actually just go pick up a phone and say, "Hey, what are you guys organizing? I want to join. I want to volunteer."
Yeah.
So one of the policies, so policy, everybody wants to point fingers at the government and say, "Oh, the government needs to write another policy. The government needs to do this. The government." What about us, the people who feel that they're being discriminated against? You also need to step up. You also need to go and be part of the conversation and the movement. And I think that that's actually one of the points that I would like to emphasize on. Yeah.
Absolutely. Now, how can individuals, regardless of their background, become allies and support the struggles of BAME communities?
Well, Toby, just as what you're doing right now, I think
Mm.
is a great first step. People like yourself who invite us to come and discuss and have conversations and
Yeah.
reach out to as many people as we can, encourage people to read books and materials, and just make a friend, come out of your comfort zone. You know, if you're going down to the pub or whatever you're doing on a Saturday, Sunday, do something a little bit more different, you know? So I think it's just an open invitation for people to step out of their comfort zones and just go and start a conversation. Ask people, what's your name?
Yeah.
And if you, for example, you find someone who has a name that's different to what you know, oh, where is that from? Don't be afraid to ask these questions, and you'll be surprised as to where the conversation might end up. So yeah,
Yeah.
I think in summary, what I'm trying to say is let's just start talking about these things.
Absolutely. And what advice do you have for BAME individuals who may be facing discrimination or struggling with their identity?
Yeah, so like I've said, I think one of the things I would really advise BAME individuals is, like I said earlier, you need to stop feeling like the victim. You need to stop feeling like, oh, people are just against you because you're black, because you're Asian, because you're this, because you're
Yeah.
that. What do you think about? What do you have to offer? You know, what is it that's unique about you? And uphold it. Be proud. You know, as I say, walk with your head up high. If you're black, if you're Asian, that's who you are. You know,
Yeah.
celebrate that. There is a beauty in the diversity. And also, just as I've said, you know, people need to reach out and start conversations. You also need to be comfortable in your own skin so that when someone comes along to you and says, "Oh, what's that on your head? Is it a headscarf? Is it a hijab? Oh, by the way, you know, your name sounds unique." Don't be afraid to start that conversation as well. So it's a two-way
Yeah.
street. And so you have to be receptive to the questions that people are likely to pose to you if you're different, and be happy to say to them, it's fine. Because you know, someone might, for example, someone said to me, "Oh, you know, where is your name from?" I'm happy, and I give a long lecture about what my name means and how it has different meanings if you're talking about it from an Arabic point of view or from a Hebrew point of view. So don't be afraid to have that conversation as well.
Yeah. Now, have you encountered any resistance or criticism while writing and promoting the book? And if so, how have you handled it?
So I think this is the beginning. I mean, for me,
Mm.
because I wrote the book, it was a passionate kind of hobby for me, and we got to the end. So this is the beginning of promoting the book and getting my work out there. And actually, I'm really excited to see what the response will be.
Yeah.
I'm also very open to any criticism. So I think this is the beginning of the conversation. The book is ready, it's out there, and I'm really looking forward to seeing what people have to say about it, whether it be positive, negative. So yeah, this is the beginning of the journey. So the answer to that is not yet, actually. I haven't had any criticism so far, and I'm
Ooh.
waiting to hear them.
Yeah. Well, looking ahead, what do you hope to see in terms of progress and positive change in addressing the issues faced by BAME communities?
So what I would like to see is, you know, like I said as well, is to see that these conversations are comfortable. I would also like to see that in the BAME community there is better outcomes in terms of healthcare, in terms of the economic outlook for these people, because we know that if you're a black or ethnic minority person living in the United Kingdom, you're more likely to suffer from chronic illness. You're more likely to suffer from mental health issues. You're
Yeah.
more likely, I mean, we're facing general economic crisis. Everybody is in a difficult situation at the moment. But if you're Black or Asian, you're more likely to suffer from poverty. So I would like to see that some of these racial inequalities, I would like to see that there's more of a gap between them. And then that will spark up the conversation because we might start talking about racism, and then you would begin to realize that these conversations will then improve the living condition of not only Black and ethnic minority people, of people generally in the United Kingdom. So, for example, I'll give you a good example. The NHS loses out £2.6 billion every year because of high rates of sickness. Well, why are
Wow.
people always calling in sick to work? It's because, like I've said, people are facing discrimination, for example, even at work. So 1 in 8 people who work in the NHS are of BAME and ethnic minority, 1 in 8. So those people are more likely to be affected by racism at work, and believe it or not, they're more likely to be experiencing racism from their own co-workers and also from patients as well as their managers. So imagine what happens to you when you go to work bright and early, you're there to do your job, to give excellent patient care, and then somebody calls you a name or somebody just outrightly treats you really badly. What are you going to do? You're most likely going to call in sick. So there's high rates of sickness in the NHS. There's approximately 1.4 million full-time days are lost every month because of sickness. So then it has a domino effect. So the people that are left on ground, there's high rates of shortages because of this sickness. So people that are left on ground don't do the work as well as they should. There's high rates the waiting lists are really high in the NHS. There is generally the care that you receive is not as good. So basically there is a domino effect that happens. So what I would like to see is if we can address some of these issues, we're going to see not only the BAME community positively affected. What I'm trying to say is going to have a bigger impact on even on the economic outlook for the country.
Yeah, absolutely. Well, what's coming up for you? Are you working on any more books or other projects after this one?
Yeah, well, interestingly, I've worked with the one of the medical bodies, the RCOG for obstetricians and gynecologists. So I was invited on there to be on their race equality panel, and that was really
Ooh.
interesting. And that was one of the reasons I sat down to write this book, because when we started the conversation talking about racism and discrimination, we realized that there is a problem here, but a lot of people are not aware of the channels to come and start discussing about them, of people are not aware of how to, increase awareness of the situation. So I'm alongside the RCOG. I'm working with other bodies, so midwives as well, to try
Mhm.
and see how racism is affecting the quality of the work that we do in the workplace and how to address them. So yeah, there's my book, and then I'm usually invited to interviews and race equality task force just to brainstorm on ideas. So yeah, I'm working on quite a few projects in at the same time, but this surely is my most exciting one, and is the
Yeah.
one that I would really like to see the feedback that comes from it, because I think this is the one that's going to reach is more accessible to people. I mean, if you're working with a midwife or a race equality task force, you're really a limited amount of people, and the work that you do might go into a policy, might go into a guideline, and a lot of the is kind of not available to the general public. But
Mm.
works like a book, it's available on Amazon, it's available in the big, WH Smith and Barnes and Nobles. You can walk in there, you can get a copy, you can read it. So that's what I'm most excited about, because it's the one that I feel would gain the most reach to people.
Absolutely. Well, it is, of course, called Is It Because I Am BAME? How Racism is Contributing to the Decline of the NHS. And as you say, it's available pretty much everywhere that you get books these days, isn't it?
Yeah, yeah. There's even e-copies, there's Kindle copies. So
Oh,
yeah,
wow.
go grab yourself one.
Excellent. Well, many thanks for joining us today. It's been fascinating to talk to you.
Thank you so much, Toby. Thanks for having me.